Thank you, Rebecca. I'll start again. Our project is still in progress, so we don't have our final results yet, but I'm going to share today about one initial aspect of our work called Community Engagement Studios. And I realized that I didn't include an acknowledgement slide, so I want to do that right off the bat so that I don't forget. Of course, we thank the APDA for their support in our project and just for their support of this field of work in general, and then my multidisciplinary team at WashU. Moving on. So, our prior speakers and Dr. Gilbert provided some pretty good background and intro to Parkinson's disease and the problem. So I'm just going to do this quickly in a nutshell. But we've heard that the vast majority of research in Parkinson's disease fails to include communities of color. And similarly, people of color have lower presence in PD specialty clinical care compared to white patients, including in neurology clinics, movement disorders centers, and rehabilitation services, as well as in community programs and services such as those offered by the APDA. In turn, this underrepresentation results in an incomplete understanding of the biological and clinical course of Parkinson's disease and considerable health inequities and health disparities. So, for example, we've heard how people of color with Parkinson's disease have poorer health outcomes, such as increased mortality, hip fractures, long-term care placement, dementia, disability, and disease severity. So our long-term goal is to reduce these health inequities and disparities and improve the understanding and treatment of Parkinson's disease by improving representation of people of color with PD in research, clinical care, and community services. So we need to increase representation before we can answer those questions that Dr. Gilbert posed at the beginning of her session. And so our APDA grant is really the first step in this process for us. In this grant, we're using a community engaged research approach, or CER. So CER aims to provide a voice and equal level of engagement for all end users of research, not only the scientists. It allows for collaboration between the community, patients, researchers, healthcare providers, policymakers, and other stakeholders so that all views are incorporated. One method in this approach is to involve the communities of interest as partners from the very beginning of the research process to identify their needs, priorities, and rules for engagement. And this really helps to ensure that historically marginalized communities are not further disenfranchised by the research. So it's been found that such an approach increases the relevance of research, it enhances recruitment, enrollment, and retention in research studies, and may speed the translation of discoveries into improved health outcomes. And so these ideas, I thought, were nicely conveyed by this quote on the slide that I'll let you read for just a minute. And we can move on. So the goal of our project is to understand barriers and facilitators to engagement in research, clinical care, and community services, focusing specifically on people who identify as Black or African American and have Parkinson's disease in our region. So in the St. Louis metropolitan or Missouri area. So that we can then begin to develop strategies to enhance engagement and representation. Although many factors, and so we plan to do this by conducting interviews with Black and African American people with Parkinson's disease. Although there are many common factors that have been revealed that might influence representation and engagement, we need to conduct these interviews in our local context because it's really important to understand the issues in local contexts. They could differ, they could be prioritized differently depending on your specific context. So as I said, to gain this understanding, we are specifically conducting interviews with Black or African American people with Parkinson's disease in our region. But before we went ahead and started doing the interviews, we wanted to get input from our stakeholders, the people that we're planning to interview, to make sure that we do it in the most inclusive and informative way, in a way that will most likely get us to where we want to go. And so we used a community engaged research approach called Community Engagement Studios, or CE Studios, which were developed by Consuela Wilkins and her group at the Meharry Vanderbilt Community Engaged Research Corps, starting about 10 or 15 years ago, as a way to support investigators in conducting community engaged research, because it can be a pretty complex process to manage. So community engaged studios are a structured approach to facilitate project-specific input from community and patient stakeholders. And they involve convening a panel of stakeholders whose characteristics are defined by the researcher to provide feedback to enhance the planning, design, and implementation or dissemination of the research. And this figure illustrates the flow. So this is the flow from the initial institution that in their core that helps with this process. We actually also have a service at Washington University School of Medicine that provides this for clinical investigators. But for our grant, my co-investigator, Dr. Joyce Balls-Berry, is an expert in community engaged research, and she led this process for us in-house. And I like this figure because if you look sort of in the bottom corners, it shows how not only do the researchers benefit from this process, but the stakeholders who are involved also derive some benefit from participating in the process. And moving along, just going back to community engaged research in general, there are different levels or extents of engagement within this approach. So, and the continuum is depicted in the table on the slide. And so just to situate us today, CE Studios, or at least how we used them, fall into this consult category. But ultimately, we'd like our work to evolve along this continuum. And so now I'm going to turn it over to Dominique, and she's going to tell you about the studios that we conducted.
Thank you, Erin. So yes, our team, we conducted 3 CE studios. In each studio, we did have one facilitator, one presenter, and about 2 note takers along with our participants. So the facilitator did introductions and guided the discussion. The presenter presented PD background and research aims. And then the note takers simply just tried to capture the conversation and the quotes, and they just mostly did observations. And the research team tried to make sure that we did not dominate the conversation. So we made sure that it was a place for the participants to share their viewpoints and their experiences. And the participants were there for about an hour to 2 hours approximately, and they were given $50 for participating and dedicating their time to us. So with our studios, again, we conducted 3. So the first studio consisted of people with Parkinson's disease and their care partners. So there were 6 people. 4 were people with Parkinson's disease and 2 were care partners. And we actually had this first studio in person because we wanted to consider the group, the participants, because we understood that maybe doing things virtually wasn't the best option. And then we had a second studio, which included providers. So that was our largest studio. We had 2 primary care physicians. We had 3 neurologists and 3 healthcare providers, which were people who were nurses, occupational therapists, physical therapists, things of that nature. And that was conducted over Zoom. And then the third CE studio was also conducted over Zoom. And it was actually a mix of care partners, people with PD, and then also healthcare providers. And it consisted of 4 people. And so moving forward, in the studio, we wanted to make sure that with the studios, we wanted to make sure that we started off on the right foot by selecting people from a diverse background to help inform our research that's geared toward the Black or African American community. So we found that it was pretty important for us to actually select community members from the Black community. So with our studios, we had 72% that were Black or African American, 17% Asian, and 11 that were white. And we had 18 total participants over the 3 studios. So we thought that that was a good way for us to help inform our study design. So for studios 1 and 2, with our feedback, we learned that what prevents Black or African American people from engaging in these different resources, like the clinical care, the research, and the community resources, like Dr. Foster mentioned earlier. And then we also learned who we should connect with, what leaders and community members we should connect with in the African or Black American community to help bridge this gap between the medical community and the Black community in the St. Louis metro area. And then we also learned what questions we should include during our interview process to make sure that these questions were essentially good questions for the Black or African American community. So we captured a lot of great actual quotes from the interviews. I'm not interviews, sorry, the CE studio, sorry. And some of the quotes included, I'll let you guys read here a little bit, but some of the quotes included things like how Washington University is viewed in the St. Louis community, especially the Black people. People felt like or feel like WashU is disconnected from the community that it sits in. The CE studio participants also mentioned not wanting to be guinea pigs. So there is that history, that unfortunate history that Black or African American people have with the medical community and also with research. And then we also learned that Black people feel as if they have not been invited to the table to participate in research. And also this information about Parkinson's specifically is not even geared to the Black or African American community. So moving on, they also provided us with some facilitators, things that we can do as a medical community, as a research team to help find some sort of solutions. So we want to, they suggested that we try to move forward and build awareness about Parkinson's, something along the lines of developing a movement more like stroke and cancer and diabetes, because that information is actually provided to the community a lot more. And also they mention Black people being more involved in the entire research process, how important that is, again, so that the community feels like the research is not being done to them. So moving forward, some of the main themes that are pretty common, is that mistrust, the fear, the lack of awareness of PD in the Black or African American community. So those are things that we pulled out, and there's just this stigma within the Black or African American community about even disclosing personal health information, and that includes Parkinson's. So those are some of the main themes that we pulled out from our CE studios that we conducted. And in the third studio was a little bit different. So the participants informed us about the study procedure, what questions should be included on the interview. So study procedure includes like ways we would recruit participants for the studies, for the interview study. And then again, they helped us develop the interview questions. And then also they commented on the recruitment materials and method. So these are the flyers that our team developed for the study. We originally had these 2 flyers, and we kind of reworked them a little bit more. And we wanted to show you these were our final flyers that we developed for the study. And again, these flyers were developed with the help of our CE Studio participants from the 3rd CE Studio. So they wanted us to make sure that the flyers were welcoming, they were warm, they were inviting, the language was simple, and everything was straightforward. So we have the green flyer that's geared to people with Parkinson's disease and their care partners. And then we have the flyer that's more of the brown color included, and that's geared towards people who are healthcare providers for those who are Black or African American with Parkinson's. So yeah, those are our final products. And then here are our social media ads that we developed for our study. So these can be posted on, Facebook, Instagram, Twitter, and so those are our final social media ads. And I'm going to hand it back over to Erin.
Okay, I'll make sure I'm unmuted this time. So I'm just here to wrap it up. So just to conclude, CE Studios, we have found, really offer a valuable approach to understanding the perspectives of community members and informing culturally appropriate and inclusive research. They're relatively low maintenance and feasible to conduct. So because it's for research development or quality improvement, we didn't have to get an HRPO or do informed consent. They can inform all aspects of a research study, from design to execution to the materials and methods that you're using. And again, they allow you to get input from your specific stakeholders. And as I mentioned, even if you get information that's common or known, these sorts of things can vary over local context. So it's really important to hear from your specific target audience or market or stakeholders. And it gives, and it can really help make sure that you're using culturally appropriate methods moving forward. So I just wanted to give you a quick sense of where we are right now. So now we're in the interview phase of the study. Over 4 months, we've recruited 21 people for interviews, most of whom are Black or African American people who we hadn't reached before for research. So we're identifying new people. And they're different from the studio participants, I should say. And really what we learned from the studios helped us to go out and be successful in recruiting for these interviews. We're getting a sense that we've reached saturation with the numbers of PD and C care partner interviews. So we're currently analyzing those data. So stay tuned for those results. I do want to point out that our biggest unanticipated for me challenge had been recruitment of providers. So I'd love to hear people's thoughts and advice on that, hopefully in the discussion portion. And then just want to mention that, even though we're still in the project, we're continuing to build community partnerships, things that we've learned from the studio. And we have also, we have a group of people from this study that we hope to build an APDA support group around. And we've also gained a board member, a gentleman who identifies as Black with Parkinson's disease, to be on our local APDA board, so he can continue to help guide this work as we move forward.